Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. And I know many of you are waiting for question solutions of your prelims exam. And just I have worked on the each and every questions which came on your prelims exams. Like I don't want to share the unnecessary thing which have not came in the exam. Just I want to share actual what thing which came in the exam, and I want to give only authentic data which is necessary for the aspirants. Like the most of my subscribers, my followers are because my content is authentic, then only they are following me. So if I am giving the unnecessary and the fast and wrong answer, means that is useless for you also, and for me also it will not give satisfaction. So I work for my satisfaction most of the things, and I work for the best content most of the things. So that's what our video went somewhat late. Okay, so here in this today's particular video, I am going to explain all the situations, scenarios, and what are the questions came on the nursing priorities. Okay, so yes, with the maximum same question and same options, you people will see with the proof from here the questions have been came. Okay, so let's begin the session of the solving the very important Norcet 9 prelims question paper now. So just I will start the session with the solving the non-nursing questions. Okay, you just one time you cross verify so whether you have went correct or wrong. Okay, so here is the first question. Question is on the who built the Jama Masjid in the Delhi? So answer for this particular question goes to the yes. I think almost all you people done the correct answer. There is the Shahjahan goes to the correct answer for this particular question. Okay. So and here with the next question in front of you all. Where is the Shanti Niketan school which is built by the Ravindranath Tagore was located? This was the question, and here is the correct answer. There is the West Bengal. In the West Bengal, the Shanti Niketan school which was built by the Dr. Ravindranath Tagore. So that is the West Bengal goes to the correct answer. Who all are choose the West Bengal as the correct answer? So your answer is correct. Okay, and here is the next question. Which Indian state has located the longest coastline? So the longest coastline is there in the Gujarat. Okay, so Gujarat goes to the correct answer, and in the options you have the same Tamil Nadu, Andhra Pradesh, Gujarat, and Maharashtra. So the Gujarat has the longest coastline. Okay, so this was the direct question which was came from these are the direct question which was came from our test series non-nursing portion directly into your exams. Okay, so and here will be the one question like the what is the meaning or the item of the break the ice mean? So that is the make the people feel more relaxed is the correct answer. This was there in our option, so this is the correct answer. Okay, so then the next question, which key is commonly used to refresh the web page or the window on the computer? Yes, a direct question from the test series. That is the F5 goes to the correct answer for this one. Which key is commonly used for the refreshing of the web page or the window on the computer? That is the F5 is the key we will use for the refreshing the window in computer. So that is the very important question. And the next question on the computer again. Which of the following can be used as the output device for a digital counter? Yes, in a digital computer. So which one is the output device? Better. So the meaning of here, this one is the consider this one is a computer screen. Okay, and here will be the keyboard. Okay, so the thing which we are using to put something information inside the computer is the input devices, and from the computer which is something coming out is the output devices. Okay, consider we will move the mouse, okay, to feed the information to the device. So the mouse is the input device, keyboard is the input device. Okay, and we are using the scanner to scan something and to put inside the computer. Okay, that scanner is also input device. But the printer, okay, after coming this page, so we will take print and we will take it out. Okay, the printer goes to the output device here. Okay, the printer goes to the output device. So the correct answer is the printer. Okay, so same options you people have in the exam. So answer for this one is the printer goes to the correct answer. Hope it is clear to everyone of you, right? So the next question is here. Where is the headquarter of the UNESCO located? Almost all you people choose the answer as the New York or the Geneva, but the answer is the Paris. The direct question which was taken from the non-nursing portion of the master nursing classes test series. Okay, so Paris or the France goes to the correct answer. Okay, so the next is, who is popularly known as the Missile Man of the India? So this question, which was striked from the non-nursing class, okay, who is popularly known as the Missile Man of the India? The popularly known name of the Missile Man of the India is Dr. APJ Abdul Kalam. The power of the millions dream. Dr. APJ Abdul Kalam goes to the correct answer. Okay, so yes. Here is the next question. Who was the first woman to become a governor of the Indian state? Yes, who was the first woman to become a governor of the Indian state? So that is the Sarojini Naidu goes to the correct answer. Okay, Sarojini Naidu is the first woman governor of the Indian states. Okay, so that is the very important. Please do consider, right? And here's the next question. Find odd among the following. So there are all the options like rectangle, which is having some angles. Okay, and the triangle and the square. Okay, so this is the square and this is a circle. So the odd one is among this one is the circle. Circle goes to the odd one. Okay, so this was the same question which was struck in your exam. Okay, so this is the odd one is in this one, right? So the next question is, what is the next number in the sequence which was given below? The very easy questions were there in your non-nursing questions. Okay, so I told you people before the exam that definitely the non-nursing portion will be very easy. So the questions have came here is also a very easy in your exams. Okay, so the next number in the number sequence, this is a question from the number sequence. The number sequence next number goes to the 32 as a correct answer. Okay, so after 2 4 4 after 4 after 8, and after 8 it's 16. After 16 it will be 32. Okay, so after 16 the next number it was coming here is the 32. So this goes to the correct answer. Okay, and these are the very important non-nursing questions what we have discussed here. Okay, so let's come to the nursing questions with probe. So people will feel very proud now, and who all are subscribers of the master batch 1.0, the psychiatric questions with the nursing management. So no one have dealt on YouTube and in your any nursing question channels. So we know that what type of the question is coming in the exam, and we have discussed that one. So thus you people have seen the maximum questions in the exam because we have exposed that thing on you people, right? So the next is here. Yes, right. So this was the question which was asked in your exam. Which of the following Rogam doses is not correctly matched with the clinical situations? Okay, so very important. In the question, the not was there, right? So here 50 microgram we are giving for the abortion which is happening in the early first trimester. So this is the correct answer. I told this particular question in the just one day before your Norcet exam. I have the proof for that one. I will show, and I will give the link of that video also. You can see from the one particular last video I have posted on the just one day before the exam at the 5 p.m. live class. So in that particular single class, there were the 4 to 5 questions have been struck. Okay, so I will give the proof for that one. Okay, don't worry. Yes, this particular option is the correct answer. 50 microgram we will give abortion before the 12 week of the gestation, and 150 microgram for the abortion and ectopic pregnancy after the 12 weeks. So this was the question we have discussed, and the correct one is 300 microgram within the 72 hours of the postpartum if the baby is RH positive and the mother is RH negative, right? So the incorrect one is the option C. The incorrect one is option C. That is the 100 microgram we are not using. Okay, 100 microgram we are not using. So the correct answer for this question goes to the option C is the correct answer. Okay, so very important, keep in your mind. So in the question they have asked or not, so the correct answer is the 100 microgram for the abortion within 12 weeks is the wrong statement, and it is not in a correct correlation with the clinical situation. Okay, so here's the proof for that one. Okay, so this is the a video just I posted just 21 hour before your class. Okay, before your prelims exam. Okay, means just one day before the prelims exam, where we have discussed what is the standard prophylactic dose of the Rogam given in the RH negative mother, okay, with the RH positive fetus. and this was the question, and this was the correct answer I have told to you people. Along with this, we have discussed the rationale for this one also. Okay, same in the same class, the rationale for that particular question. Okay, you can see here. Okay, so look at this one. Ectopic pregnancy, abortion, molar pregnancy, 150 microgram, injection, rogam, I told, intramuscular route, irrespective of the RH incompatibility, sensitivity to mother, and the if the mother is negative, father is positive, father is positive, we will give that one. Okay, and if the according to the National Health Mission guidelines, we told that is the before 13 week the microgram, that is in the early first trimester, I told 50 microgram was the correct answer. Okay, so all three situations have been struck in your exam. And here comes to the next question. Again, the question which was from the last class of your prelims exam, just the magic session before one day of your prelims exam, the Montex test for the tuberculosis screening. What is the correct route of administration? So the answer for this particular question goes to the intradermal is the correct answer. Okay, so this is the correct answer, and here is the proof what we have dealt just one day before the exam. Okay, so there is the 3.1k we went, that is the 21 hours ago the before the prelims exam. Okay, so I were there here, and here will be the thing what I have dealt in front of you people. It is a type of the delayed hypersensitivity reaction to the Mycobacterium tuberculosis antigen, and here we are giving the PPD, that is the purified protein derivative we are giving here. Okay, here we are giving to the ventral portion of the forearm, I told, and the route of administration also highlighted, that is the intradermal. So this was your prelims question. We have studied one day before, it have struck in the exam directly. Okay, so the same 5 tuberculin unit or the 0.1 ml. I told to you people, this entire sentence was there in your question. Okay, in the question was big, like to assess the sensitivity to the tubercular exposure. Okay, so 5 tuberculin unit or the 0.1 ml, where we are giving the purified protein delivery. Okay, purified protein derivative. So at the end they have asked which route we will administer. So that is the intradermally goes to the correct answer. Okay, so just one day before I have discussed it. So this tuberculin skin test we also called as the Montex test or the Percute test or the tuberculin skin test. Okay, so the same thing which have been struck in your exams. Okay, so yes, the next is here. A patient with history of the psychotic disorders begins to act overly dependent on the nurse. Okay, so he is beginning to act the over dependent on the nurse, right? So and says you remind me my mom, or you remind me my sister, like this was the question. So simply in the last class of the your prelims only, just again I have discussed, if the patient is showing any emotional response on the healthcare provider or the nurse, so that is what you call as the transference. So this was the direct question which was asked in your exam, and here is the proof for that one. Okay, just again 21 hours before your exam. Okay, here's the transference. I told this is the last point what I thought to people. I told among these three words, one question will come. I told like confabulation, counter transference. But in the exam, two came. Okay, that is the transference and the counter transference are the two very important situations which was asked in your exam. Okay, so I hope you people have enjoyed this particular session, and you people have felt very happy when you see these questions. Okay, and many of you have messaged me, sir, whenever we are reading the questions, we are remembering you in the exam. So that is the very specialty of the master nursing classes, and that is very a special bond what I have with my students, with my like a normal level of the teaching, and with my quality content. Okay, so this is what I told, keeps on telling you people to believe in the master nursing classes, because it works on the quality. Okay, so quality always makes you a champion, right? So here this is the way to make you a champion. Okay, so this was also the question which was there in the exam. Which of the following is the example of the counter transference shown by a nurse? Okay, so in this option, so many of you people went into the confusion that like listening to the patient feeling and sharing the personal information with the patient. So these both were in the option. Okay, beta, listening to the patient feelings is a normal therapeutic thing. Okay, if the patient is expressing some feeling, means so we have to listen that one. So that is the normal therapeutic communication. But we are sharing our personal information with the patient, means that is the what we are doing, the counter transference, means a nurse or the healthcare provider, he is emotionally attached to a particular patient. So that is what we call the counter transference. Okay, so both questions have been struck in your exam. And so listening to the patient feeling is the this is the normal therapeutic relationship. Okay, so this is not any boundary relation, this is not any kind of the transference or the counter transference. And students who have subscribed to the master batch 1.0, same to same questions with same to same options I have discussed in the psychiatric, the concept called as the therapeutic communications, where I have told this all the transference, counter transference, boundary violations, and resistance. So the very important forward among the forward, one question will come in your exam, I told, but the two questions have been came. Okay, so yes, this is the what we will work for the quality content. Okay, so here comes to the next question. Anaphylaxis is leads to which type of the shock? Beta, again, this was the question which we have discussed just 3 days before the prelims exam. Okay, so in your magic session numbers, second or third, I think so. Okay, so in that particular session, I told type of the distributed shock, where I have told the mnemonic. How many of you are remembering? Okay, after passing the nursing officer exam, you become a senior nursing officer. After passing the senior nursing officer exams, you become a assistant nursing superintendent. I told. Okay, that is the ANS. Okay, ANS. That is the assistant nursing superintendent. I told, right? Assistant nursing superintendent, or the autonomic nerve system, I told as a mnemonic for the types of the distributed shocks. Right. So in this one, this particular question, yes, anaphylaxis is a which type of the shock was their question. So anaphylactic is a shock which is, we call that one as in the a distributed shock. This was the answer which have been struck in your exam, right? Is that clear, beta? Yes, anaphylaxis leads to which type of the shock? This was the question which was asked in your exam, and this is the type of the distributed shock what we have dealt in the very important last minute and rapid revision sessions for your exams. Okay, here's the next question. Yes. How many drops are administered per dose of the rotavirus vaccine? Okay. So simply rota vaccine dose they have asking. Okay. So option A 1 drop, option B 2 drops, option C 3 drops, and option D is the 5 drops. Okay. So this was the what we have discussed in our rapid revisions beta. Just 4 day of the our prelims exam. Okay, where I have discussed the very important rapid revision and golden points on the a very important concept for the prelims. Okay, so in this one I have told to you people rotavirus vaccine will be given 5 drops orally. Okay, at the respective schedule of the 6 week, 10 week, and 14 week. So this was the question which was asked in your exam. Rotavirus vaccine route and dose, that is the 5 drops. Okay, oral polio vaccine 2 drops orally, and the rotavirus vaccine 5 drops orally. Every point we have discussed was the golden point, because it is giving you a 1 mark, and which is taking you away from the crowd, and which is making you get select in the list. Okay, so that is what master nursing classes is very special. Okay, so we are not hitting the 7 to 8 hours continuous class. We are just taking the class which is necessary for your selection and which is necessary for your rank. Okay, so that is what you have to believe in the master nursing classes and the quality content of the Mr. Nagras. The answer goes to the 5 drops. Okay, so very important. Let's begin the next one. Okay, so which of the following best represents the clinical sign of the head injury? The classical triad of the Cushing syndrome. The components was asked in your question. Okay, very important. In the questions they have asked the late sign or the late clinical sign. That is the classical triad of the head injury. That was the Cushing triad components. It was asked in your exam. And here comes to the explanation for the Cushing triad beta. Look at this particular explanation. Just 5 days ago of your prelims exam, we have discussed the Cushing triad, and the question also I have discussed where I mentioned it is in the not early sign, it is the late sign. If you want, you can revise it because it will be helpful for your exam. And whatever the classes I took, that is the Norcet selection series, it is must once again to revise if you have taken the notes. Otherwise, keep all the video in the two at least 1.5 to 2 speed. Okay, and finish the video as soon as possible. Again in your mains exam, from these classes, maximum questions will strike. Students, I am giving you with proof what kind of the questions are coming and how the questions are coming. Yes, this is more than enough for your selection, right? Very important, keep in your mind. Okay, so we have discussed the question on the Cushing triad, and where I have discussed the very very important components of the Cushing triad, that's the bradycardia and irregular respiration and the hypotension with increased SBP and widened pulse pressure. Okay, so very very important. And here also the question have been asked the same. Okay, the classical Cushing triad. Okay, so the lead sign, that was the bradycardia, widened pulse pressure with hypertension and the irregular respiration. So this was the correct answer for this one. Okay, this was struck in your exam, right? So the next question is here, and I have got lots of the positive comments from you all, and still many messages I am unable to read because just I were focused on to check all the NCLEX book and also like where the question is coming, because without analysis telling something in front of you, you all, which makes me feel inadequate. Okay, so I will be very much authentic, and I will be like trying to come up with a very important information that was necessary, okay, by avoiding the unnecessary things. Okay, so I got lots of the positive messages from your lines, like many of you are saying that the like it was helpful, test series was helpful, and 100% like it was striked in the exam. Okay, and along with that like also take a class for the mains also, there was like some requests are okay. Along with that many students have been like telling that we were remembering you sir in the exam. Okay, so many positive messages I got, and a few of them I am getting the screenshot here for you all. Okay, so and thank you so much for your love and everything. So this was makes our heart to feel overwhelmed. Okay, so this is what a student teacher attachment, what we can say. Okay, yes, thank you so much for your love and support towards the master nursing classes. If you are believing in us, means which makes us more responsible to work towards your job, right? So yes, we will make it possible, right? So thank you so much for your very highest trust on the master nursing classes, right? So the lots of the comments messages are there, so I will share the PDF. Okay, so this much big messages. Okay, so thank you so much for everything what you people given to me, that is uh like I'm unable to express the thing, right? Some things are just need to feel, right, not to express, right? So yes, here's the question, and the question was taken from the lithium carbonate toxic effect. Yes, the patient is taking the lithium carbonate and reports the nausea, blurred vision, and the confusion. Yes, the patient who is taking the lithium, if he is reporting any nausea, vomiting, or any GI symptoms, consider this one as the earliest sign of the lithium toxicity, right? Along with that, he is having the specific signs also like blurred vision and the confusion. So this is also specifically associated with the lithium toxicity. Okay, so the question was asked, what is the nurse's priority action? Same question we have discussed. Look at this one, students. Which of the following is used by the nurse as a case of the lithium toxicity? Okay, so in the options I told, stop the lithium and start the IV fluid is always and always it goes to the priority answer. In our prelims exam also, the question was asked is the priority action. So answer goes to this one is the very important. Withhold the next dose is the correct answer. Okay, if in case in the exam he is mentioning the serum lithium level is more than 2.5 milliequivalent per liter, so the next, which is the next best step of the management, the next best step of the management is the hemodialysis. Okay, so if it is going more than 2.5, so we have to go for the hemodialysis, right? So but in the question what they have asked us, so this was the explanation what I given to you people. Okay, so lithium toxicity is happening means the earliest sign we will get is the nausea and vomiting. To replace the fluid which was lost by the nausea and vomiting, we will give the of IV fluid. Along with that, the first thing and the priority thing what we have to do, we have to stop the lithium. Okay, this was the question which was directly asked in your exam, right? This was the before exam screenshot and what we have struck in the exam. So that's the very important thing. Okay, and here is the video I have shared to you people, that is the from the Manverse. Okay, so I told from the Manverse video, Definitely 2 to 3 questions will come. Yes, the 2 questions directly came in your exam. Okay, so let's see what are the questions which came from the manuals. Okay, a laboring woman has a shoulder dystocia, and here the laboring woman, she is having the shoulder dystocia. After calling her help, after calling for the help, what is the first maneuver which will help to assist with this particular shoulder dystocia? Yes, I told the first and best maneuver. Okay, always look at this particular important OBG classes manual video what I have shared in your WhatsApp channel and in your WhatsApp groups. I told to you people, students, please read all the OBG manuals. Definitely the question will comes. Okay, so yes, the question have been struck in your. I told in the class this was the first maneuver and the best maneuver for the patient who is having the shoulder dystocia is the Mac Roberts maneuver, the direct question which have been came in your exam from the master nursing classes, a very important obesity maneuver classes. Okay, so very important, right? So the answer for this particular question goes to the yes, assist with the Mac Roberts maneuver is the correct answer, right? So very important for you all. Here comes to the next question. And this particular question, what you have seen above, that was the question multiple time repeated in your test says also, right? So the next question is here. During vaginal birth, during vaginal breech delivery, baby's body has delivered. Now body has been delivered, but the head remains undelivered. Head is still inside the vaginal cavity only. Now nurse allow the baby to hang freely. The nurse is allowing the baby to hang freely and grasp the feet at the ankles. Okay, grasp the fetal ankles. Okay, and along with that lift the baby upward in an arc. The same to same question body. Okay, so which of the following maneuver is performing here? This was the question which was asked in your prelims exam, and this was the question what I have explained to you people here. Okay, before the exam, this was the Burn Marshall maneuver. Okay, this was the Burn Marshall maneuver. So what we have to do? We have to allow the patient to allow the baby to hang here freely. After that, we need to hold the ankle. I told. Okay, and we are bringing it like in a upward arc. Okay, so that was the thing, and here the head will get delivered. So it will be a best maneuver to deliver the head of the baby in a breech presentation or the after coming delivery of the head. So we are doing by using the Burn Marshall maneuver. So this was the direct question which was came in your exam from the again master nursing classes YouTube channel by the Mr. Nagaraj sir. Okay, so hope it is clear to every one of you. The maneuver we are doing here is the Burn Marshall maneuver, right? Yes. So I hope this all thing helped you all, right? So here is the next question. Yes, a 28-year-old pregnant G2P1 gravid to parity 1 woman at the 32 week of the gestation presenting with a sudden onset of the severe abdominal pain and a vaginal bleeding. Beta, this particular concept many time I have explained to you people. Okay, on examination her uterus is tense, tender, and one baby is bradycardic and another baby has the absent fetal heart sound. Okay, absent fetal heart sound. What is the most likely diagnosis? Beta, I told there are the two situations in the antepartum hemorrhage. Okay, so there are the two situations. One situation is the painless vaginal bleeding. Painless vaginal bleeding. Another situation is the painful vaginal bleeding. So if there is a patient is having the painless vaginal bleeding and the bright red blood is coming out, so this is the case of the placenta previa. And if there is in the a painful vaginal bleeding and from here the dark red color blood is coming with the pain, so that is the a patient with abruptio placenta. So this was the a concept which the master nursing classes Mr. Nagaraj sir explained to you people, and here is the proof for that one. Look at this one. A 30-year-old woman, same question. Okay, here just a G3P2. Okay, and now she is having the 34-week gestation and presents with the sudden onset of the abdominal pain, uterine tenderness, and the dark vaginal bleeding. Okay, what is the most likely diagnosis? Same question, abruptio placenta, which was struck in your exam. Okay, in the explanation also I told to you people, a placenta previa and abruption placenta. Okay, in the complications I told, here will be a fetal loss or the fetal distress will be there. Okay, so in the given particular question scenario, they have mentioned there is a twins babies. One baby is having the bradycardia and another baby have the absent fetal breath sound or absent fetal heart sound. Okay, so that is the absolute case of the abruptio placenta. Okay, so I told it is a sudden, it is the painful, it is the dark red vaginal bleeding, and there is in the uterine tenderness is present, and uterine tone is the rigid and tender. Okay, so and these are the very important clinical scenario based question, and here also a clinical scenario based questions what I have discussed in front of you all. So the question was there in your exam, right? So this was the promise made by me, and I have coming with the proof in front of you. Okay. So here is also a same to same question which was asked in your exam. A 30-year-old pregnant woman at the 38th week of the gestation with history of the BP 160 by 110 mm of Hg and proteinuria 3 plus. The diagnosis as a eclampsia. In the question only they have mentioned this was a case of the eclampsia, right? So what is the best step of the management? Students, I told you people that in the question, look at this one. Which of the following is correctly describes the Pritchard regimen for the magnesium sulfate administration in the eclampsia? So in the eclampsia, magnesium sulfate administration, both regimen completely detailed. I have told you people, and while discussing this question, I told it is in the very important question, right? So just you are understanding that in the eclampsia, we using the magnesium sulfate, that is more than enough to give the answer. Along with this one, I have told the time of the placenta or the fetus delivery during these particular conditions, especially in the eclampsia, immediate delivery of the baby is required. In the question, the both options are there. Okay, both options means in only one option, two things are there. Okay, so if the mother is having the eclampsia, the best and the like final management or the definitive management for the patient with eclampsia is to immediately deliver the baby and the placenta. That was the definitive management. Okay, and here in the question there is a option like give the MGSO4 and prepare for the immediate delivery. So this was goes to the correct answer. Okay, so in the cases of the HELP syndrome, in case of the pregnancy induced hypertension with abruptio placenta and pregnancy induced hypertension with fetal distress, HELP syndrome and eclampsia, we will immediately deliver the baby. This was the question which was asked. This was the concept which was explained by me in the just in your very important Norcet selection series what I have conducted for the last 20 days. Okay, so yes, that was the question which was struck in your exam, and at least 2 or 3 times I have discussed the question on the magnesium sulfate, its toxicity, its early sign of the toxicity, and its doses, Pritchard regimen, and the Jupsin regimen, everything which was there for necessary for your exam, I have given to you people before the exam. Okay, so I hope every one of you made this particular question correct. Yes, at the end of the video, you please do mention how many questions you have got correct from this particular like question paper analysis, what you are getting here. Okay, the next question is here. A 28-year-old woman presents with a heavy vaginal bleeding 6 weeks after the evacuation of the molar pregnancy, and her serum beta HCG level remains markedly elevated. Which of the following is the most likely diagnosis? Beta, this was the a thing what I have explained to you people. That's the molar pregnancy which is getting converting into the yes, gestational neoplasia or gestational trophoblastic neoplasia. So this was the question which was just asked from the your very important MCQ on the high yield topic for the Norcet preparation. Okay, so by the Nagaraj sir, the same question which was there in your same concept which was there in your very important prelims exam, where I told this molar pregnancy may get converts into the malignant. Okay, so that is the most commonly it will get converts into the gestational trophoblastic neoplasia. So that is the thing what I have explained to you people. And in the option same thing, already we have evacuated the a molar pregnancy. Even after the 6 week, the molar pregnancy, even after the 6 week of the molar pregnancy, her serum beta HCG level is remain markedly elevated. Okay, so her serum beta HCG level is still high only. So what we will expect, So that particular molar pregnancy, the benign molar pregnancy, it get converts into the gestational trophoblastic neoplasia, the malignant condition of the that particular molar pregnancy. This option B goes to the correct answer, the gestational trophoblastic neoplasia. This is what studying the important thing actually means. Okay, so studying the entire thing is different. That you people will get in the 7 to 8 hour marathon classes. Studying the important thing you will get in the master nursing classes YouTube channel and in the master nursing classes app by the Mr. Nagraj sir. Okay, yes. So this is the actual meaning of the studying the important thing. Okay, so this is the actual meaning of the high yield topics. Okay, so very important, right? So yes. Right. So next question is here in front of you. A 26-year-old woman presents with a vaginal bleeding 2 weeks after the uncomplicated vaginal delivery. Okay. So what happened here? A 26-year-old woman is there and she is having the vaginal bleeding 2 weeks after the uncomplicated. Means there is no any lacerations, there is no any trauma to the perineum. Okay, and there is no any obstructed labor, so nothing. It's a normal vaginal delivery or uncomplicated vaginal delivery have been happened 2 weeks ago. Okay, and her vital signs is stable and she reports there is no any false smelling and there is no any fever. So what is the likely cause of this particular bleeding? Beta, I told in the class in the types of the PPH or the after delivery bleeding. Okay, so there is the primary PPH, okay, which happens within the 24 hours. The most common cause is the abruptio placenta. Okay, and the secondary PPH, which happens from 24 hours to the 12 weeks. Okay, the most common cause is the retained placenta. Now in the given question, she is bleeding 2 weeks after the normal vaginal delivery. She is bleeding 2 weeks after the normal vaginal delivery. So that is what we call uncomplicated. Means it is not in vaginal laceration, it is not in the coagulation disorder. It is due to the retained placenta. Who have given the answer correct as the retained placenta? This was your exam question and this was your rank deciding question. Hope it is clear. Alright. So the answer for this particular question goes to the option A. Right. So this was the same thing what I have explained to you people. Okay, just 2 weeks before the exam. Okay, this was just 2 weeks before the exam. So in the important MCQ on the high yield topics for the Norcet preparation by the Mr. Nagraj sir. Okay, so here is the next question, right? Yes, it took somewhat lengthy time to me to get prepared because all the questions which was there in your exams was somewhat lengthy. Okay, so few of coaching center people, they are telling the paper was easy. Actually, the paper was not easy. So I have given all the prelims paper. Among all the prelims paper, this was the paper which was the toughest prelims paper I have ever seen. Right? Tough in the sense it is tough for the beginners, tough for the students who are not studied from the master nursing classes, and tough for the students who have not practiced the MNC test series, right? So yes, because you people have been exposed to all the situations, right? So that's the reason it was very much easy to you people, right? Here is the next question. A 35-year-old man with a schizophrenia has started on the haloperidol. The patient is on the haloperidol, and a few days later, he developed the sense of the inner restlessness and inability to sit still. And now he is constantly facing, okay, what is the most likely diagnosis? This is the question from the extrapyramidal symptoms. The answer for this particular question goes to the very, very important akathisia. Okay, same thing in your master batch 1.0 explained. Students who have seen the entire psychiatry 50 videos from the master batch 1.0, your single point also have not missed. Yes, even a single point also have not missed from the psychiatry because it was properly described by the Mr. Nagraj sir in the master nursing classes. Yeah, the 1.0 master batch. For the next Norcet 10, you will also get the new batch. Wait for that one. Okay, wait for the announcement. Right. So here's the same question. Which of the following is characterized by the inner restlessness and inability to sit still? Yes, the same question was there. Inner restlessness and the inability to sit still. This was the question which we have discussed in the master batch. Okay, and here is the same thing. Inner restlessness and inability to sit still. Akathisia. Okay, so the same question. Right. Here comes to the next one. A woman is in the labor with 5 centimeter dilation and 40% effacement is there. and -1 station. Which stage of the labor is this? Students, before the exam, I told the guidelines or the new updated guidelines according to the labor care guide. I told 1,000 times not to go according to the partogram because the partogram is already an expired. Now we have the labor care guide which is given by the WHO. I told you people to go according to the findings of the labor care guide. And I have told here in this particular question also, look at this one. According to the labor care guide, new one, latent phase is the 0 to 5 centimeter and the active phase is the 6 centimeter and above. 6 to 10 centimeter is the active phase. In the given question, they have given there is in the 5 centimeter dilation and 40% is effacement and the -1 station. This was the woman, she is still in the latent phase, she didn't came to the active phase. The active phase, it will start from the 6 centimeter dilation according to the new World Health Organization, new WHO labor care guidelines. So this was the answer which is there in your exam. The latent phase goes to the correct answer. Okay, so yes, very important. And this is the question which was came with the 2 correct options in your exam. Okay, which of the following weekly oral contraceptive options we are giving? So in the options, the Chaya also there, Saheli also there, and many of you have went for the Chaya or the Cherry. So both are correct answer. Beta, this centchromine or we also call this one as in the Chaya, or also we call this one as in the Saheli. So these all are same. Okay, we will give this dosing as like this. I have told in the previous sessions the usual dosing schedule of the centchromine or the Chaya or the Chayal is the 1 tablet twice a week we will give for the first 3 months, then once a week. So in the question, the contraceptive methods where we are giving for the weekly ones, okay, or the following weekly we are giving the oral contraceptive. So that is the both goes to the correct answer, and this one you have to report in your query sessions in your portal. So they will give the bonus marks. Definitely they will grant you a bonus marks for this question. Don't worry. This question and in the non-nursing portions, coding decoding question, both questions will get the bonus. Don't worry, because that is also the wrong question. Okay, so yes, hope it is clear. The answer for this goes to the option A and B, both the correct. And in the exam, when you see this question, the both options are there. By mistakenly, it may be a printing mistake. Yes, human error happens. They will give the bonus point. Don't have to worry about this one, right? So the next question is here. So this was the question which was asked from the family planning and the contraceptive. Okay, Norcet, very important classes. Okay, yes, because it is very important. So then only the question will come from here. Okay, so yes, the next question is here. A 30-year-old man with a history of the bipolar disorder, in a manic episode, he is complaining of his food is poisoned and refuses to eat. So what is the most appropriate initial interventions? Beta, the patient is having a manic episode in the bipolar disorder. He is in the now manic episode, means he is in the hyperactive mode. So for this patient, we have to always give the packed food and fingertip food. So because this patient, he will not sit in one area, he will be keep around roaming. Okay, so easy to carry food, fingertip food and the packed food which highest rich carbohydrate we will give to the patient. Okay, so option A, taste the food in front of the, so this is not confront, it is on the in front of the patient. Okay, so the patient is telling this is the poisonous food, so the nurse is eating the food in front of the patient and she is assuring that it is not poisonous. So this is not in correct technique. I am eliminating the option A. So then comes to the option B, administer the high dose of the antipsychotics immediately. So this is also not a nursing intervention. So we are allowing the patient to pick the packed food. So this is the correct answer for this particular question. And whoever marked this one, allow the patient to pick the packed food. So this was your correct answer. Okay. So and here is the next question. A dementia patient suddenly getting the catastrophic conditions where he started screaming, crying, pushing away. Like this was actually in the question, this is the only the dementia patient suddenly in the catastrophic reaction. What is the most appropriate initial nursing intervention? Direct question which was struck from your master batch 1.0 psychiatric sessions. Okay, so the question is like this. The answer is the use the non-stimulating environment. Option B, use the physical restraints to patients to prevent injury. Option C, touch to make calm the patient. No, you should never ever touch the hyperactive patients. Okay, and the option D, immediately administer the sedatives. Beta, the question answer goes to the use the non-stimulating environment to the patient. Okay, this is the correct answer. So the catastrophic reactions, confabulations are the very important concept from the dementia. So that I have discussed in detail in perfect in the master batch 1.0 in your master nursing classes. Yeah. Okay. Same thing which was tried in your exam. Okay. And here's the image based questions. Almost many people have seen the image, and in the option A you have seen the ampelocele and chosen for the answer. This is not a question of the ampelocele beta. So this is the suprapubic area. Okay, with the diastasis. Are you able to see the diastasis here? Means separation of the our what we can say symphysis pubis have been separated. Okay, so from here what happened, the bladder means anterior abdominal wall also open, which is below the umbilical. Okay, so the bladder is coming out. So this is what we call the extropy of the bladder. This is what we call the extropy of the bladder, the same image which was there in your exam. Okay, which was struck in the exam. So this is the what we call as the extropy of the bladder. Okay, that goes to the correct answer. Right, the next question, that was the Gardasil in the important OMBG questions previously. Okay, in the previous sessions I told you people regarding the Gardasil cervirax. Okay, so which one is the nonavalent, which one is the octavalent. Okay, and which one we are giving to both male and female. Okay, what is the age criteria of the cervical cancer vaccine, everything we have discussed in the question. The simple answer was there. This particular Gardasil is used for the treatment of the which particular, sorry, prevention of the which particular thing. So it is Gardasil is the vaccine we are using against the cancer of the cervix. So this was a correct answer for the what we have had in the exam. Okay, so that's the very important, right? So here's the next question. So students, this is not a best method. Still the examiner have been asked that the delivery of the placenta by the fundal pressure. Okay, this was the answer for this particular question was the delivery of the placenta by the fundal pressure. Many of you have answered this is the control cord traction. It is not control cord traction. In the control cord traction, we will give the pressure here on the suprapubic area. One hand we will keep. Okay, and by holding after separating the placenta, we will hold this umbilical cord with one hand. We will slowly pull it out, and we will give the suprapubic pressure, not a fundal pressure. Okay, so this is the technique where we are using expulsion of the placenta by the mild fundal pressure. So this is the correct answer. Okay, so it's not a controlled cord traction. Okay, so who all are choosing the answer? This was the expulsion of the placenta by the fundal pressure. That your answer is the correct answer. Okay, so that was the direct image which was struck from your this is the OBG book. Okay, and this is also question which was struck. Okay, so this was the ulta question. Okay, I asked in the in your drug abuse MCQ I shared in your WhatsApp group. Okay, so this was the important I told, because in every Norcet exam there is one fixed question which will come from the drug abuse, right? So I told you people, and this was the a special video which I have posted for the Navagraha plan students, right? So here a first question only. In this video, first question only I have discussed on the LSD. Okay, in the question, a patient was on the drug abuse and he is getting the hallucination and he is getting the pullback phenomena and all. Okay, so in that one, which drug abuse he is doing? So that was the LSD is your correct answer. Okay, so this was the also question which have struck from the master nursing classes channel. Okay, who have heard the explanation of this question, definitely those people will do the correct answer for this one. Okay, so hope it is clear to every one of you. Right, here's the next question. A 4-year-old child was brought to the emergency department after the accidental ingestion of the kerosene. So there is the kerosene poisoning question was there, and he is coughing and his mild respiratory distress is there. Which of the following is most appropriate step regarding the gastric lavage? Okay, so which is the most appropriate step regarding the gastric lavage in the kerosene poisoning is the beta. So nurse must know that in the kerosene poisoning we are not doing the any gastric lavage. We are not inducing the vomit. Okay, so induction of the vomiting and doing the gastric lavage is contraindicated. Okay, so this you must and should know. Okay, so that is the gastric lavage and the induction of the vomiting is contraindicated, and who all are choose the correct answer as the gastric lavage is contraindicated, so it goes to the correct for you all, right? So yes, in the option here there was the insert 30 centimeter of the NG tube also was there, so yes, that is not going to the correct answer. This particular question, there's the option B goes to the correct answer. Hope it is clear to everyone of you, right? So the next one is here. Many people telling that this is the tachycardia, this one is the that thing, this thing, and only few people like master nursing class students noticed that in the question there was a word which was mentioned as in the 3 months child. Beta, for the 3 months child till 160 it is on the normal heart rate. Okay. So in the question which was given as the 250 or the 230 above, it was the heart rate is there. So this is the classical, classical ECG finding of the 3-month child with supraventricular tachycardia, which is going to be a correct answer for your, right? So while I choose the supraventricular tachycardia, no, it is not sinus arrhythmia, it is not sinus tachycardia, nothing. It is the supraventricular tachycardia classical image. Okay, so hope it is clear to every one of you. So if you are choosing this one as the correct answer, your answer is correct. Otherwise, your answer is finish. Yes, here is the question. A 30-year-old female presents with a severe abdominal pain for the diarrhea and vomiting. A simple question, just twisted and asked in the question. A 35-year-old female, she is present with a severe abdominal pain and diarrhea, vomiting, and during the abdominal examination, after inspection, what is the next best step nursing officer should do here? Students, this is a simple question which was asked from your sequence of the assessment of the abdominal area. So any other areas like head and chest, if I am assessing, means what I will do, first I will inspect, then after that I will palpate, then after that I will do the percussion, then after that I will do the auscultation, right? But whenever you are assessing the abdominal cavity, so after the inspection, the first thing you have to do is the auscultation. I already explained the question. After the auscultation, then we have come to the percussion, and the palpation goes to the last in abdominal assessment. Right, this was the simple question which the exam have been twisted for you all, right? So yes, who all are assessed this one and who have grasped for the question, those people have chosen the correct answer, beta. So here, after during the abdominal examination, after the inspection, what is the next best step? After the inspection, what we are doing in the abdominal, we are doing the auscultation in the clockwise direction. So the answer for this question goes to the who all are chosen the auscultation in a clockwise direction. So your answer is correct. Your answer is correct, right? So this is what we have to stick to the very basic sometimes to give the correct answer for the very complicated questions, right? So this was which is looking like complication, but it is not a very easy question, right? So many of students are thinking like, why not percussion, why not deep of abdominal palpation? Because this is a simple concept in the abdominal assessment. After the inspection, we will go for the auscultation, then we will go for the percussion, then we will go for the palpation. Why? Because before auscultation we are doing the palpation, means it will alter the vowel sound. Okay, it will give us the false low or the false high vowel sound. So that is the what we don't want. Okay, the false thing. Okay, very important. Please consider, right? And from your crash course videos, so what I have shared in your groups, from there the one question have been came on the BP cup size. Okay, so the small BP cup size which will boost the false high blood pressure. So that was the correct answer, right? So here is the next question. Yes, during the abdominal assessment, the nurse finds the patient's abdominal is rigid, board-like, and marked tenderness. What is the next best nursing action is your question. Yes, in this particular question, it is a sudden formed case of after the ruptured appendicitis or after the ruptured gastric ulcer. So now the patient is having the peritonitis as a complication of the appendectomy rupture or as a complication of the gastric ulcer perforation. Now, if we are finding this particular thing, that is the board-like abdomen, rigid and tight abdomen, the next best step of the management is the not to go for the deep palpation, not to go for encourage the patient to go for the abdominal exercise, and don't you should not apply any heat application on the abdominal muscles. So inform the physician goes to the correct answer. Inform the physician immediately goes to the correct answer for this particular question. Okay, so here comes to the next question. Yes, which of the following is the most effective in performing the lung expansion and preventing the post-operative atelectasis? There was a question like a patient came from the OT after the general anesthesia and post-operative day 2 in order to prevent the atelectasis. Beta, the question I have discussed the cause of the post-operative day 2 fever. That was the atelectasis. And what I have told to you people to prevent the atelectasis? Yes, a very important thing. I told to you people to use the incentive spirometer and for the proper lung expansion, the breathing exercises. Okay, in the question, they have mentioned that there is a small incisional side pain also it was there, patient was feeling. Okay, so just we need to ask the patient to support the suture with the pillow. Along with that, we will give the high polar position to the patient for the complete expansion of the lung. And in the question they have asked for the proper expansion of the lungs, which position she will give. Yes, all are given the correct answer. That is the high polar position. So this was your correct answer. Okay, this was your correct answer. Hope it is clear, right? So the next is here. A patient with acute pancreatitis is found to have the bilateral lung infiltration. Better the case of the RDS, the respiratory distress syndrome in the adults. Okay, ARDS. That is the non-cardiogenic pulmonary edema. We have discussed in the class. Did you people remember the bilateral infiltration of the lung? Okay. Yes, bilateral infiltration of the lung or the whiteout lung or the wet lung. We have discussed on chest X-ray. Okay, so we are getting the bilateral infiltration of the lung, and along with that, oxygen saturation which is dropping to the 88% with O2 support, right? And is producing the thick respiratory secretions. Also, the patient is dyspneic and has the labored breathing. Okay, what is the priority in nursing interventions in this situation? Beta, I told you people that in case of the ARDS, in case of the acute respiratory distress syndrome, the management is the low volume ventilation, in prone position. In your option, what is the next best step of the management after administration of the oxygen? So we will give the prone position. Who have chosen the correct answer as a prone position? Your answer is 100% right. If you want, you can see the Norcet tour selection series. All the videos in that one I have discussed the ARDS, that is the non-cardiogenic pulmonary edema, where I have told the management of that one also a low value ventilation with the prone position ventilation. The question have been asked in your exam directly. Okay, so very important, right? So bilateral lung infiltration, the classical symptom of the very important ARDS suddenly which happens due to the pancreatitis. Yes, so that was the very important question. Okay, so these are the some very important questions I have tried to cover with the same options. Okay, hope you people enjoyed this particular session, and in the tomorrow's session again I will come up with the remaining questions. Okay, so with the same option again. So it takes little time because students to get the authentic data and to get the correct answer, it takes little bit time. Okay, so yes, there are the many YouTube channels are there, you can refer for the emergency but not for the authenticity, right? I told very few nursing channels are there, so they are moving with authenticity, but authentic data will not always immediate data, right? The authentic data will comes with proof, that is somewhat late only. Okay, yes, so that is the reason the upload of the video somewhat went late. So that is for your well-being purpose only. Okay, so remaining questions we will discuss in the next session also, and don't forget to practice the mains practice test from the master nursing class. Yeah, okay, so we will soon release from the tomorrow morning 6 a.m. onwards, the paper will come live in front of you all. Okay, so stay connected, stay motivated, keep preparing. Okay, so all the best for your prelims exam. And if you are scoring the 50 marks and above, means definitely you will score. Even you will get selected in the prelims. Even if you are from the unreserved male category. Okay, yes, 50 to 55 is the best score because the paper was somewhat tough, right? It is looking easy to you people because you people have been exposed to these particular situations before the exam, right? So we will hit hard again to the mains exam, and I will be with you all as your backbone and as your friend, as your coordinator, as your guide, and as your motivator. I will be there for you all. Just I want the good rank, and I want the all India rank number one. So who will do that one? I will give a special gift, and I will arrange for the a very special what we can say interview also, right? So yes, stay connected, keep motivating, work on the your brilliance. Yes, definitely victory will come towards you only. Peace, all the best, enjoy, start preparing for the mains. Thank you so much for watching the video till the end, and in the tomorrow session again I will come with a very very important questions you all. Okay, stay connected, stay motivated, keep preparing. Bye bye, take care, love you all.